for the past 1 hour. You are tuned into the Literacy Hour with Test Taking Solution and your host, Dr. Kentrell Liddell, M.D., M.B.A. The purpose of this show is to help mitigate health disparities, improving literacy related to health, economics, and education. For all your professional development, professional management, and educational support services needs, contact Test Taking Solution, where we're igniting success. Located at 2104 Thousand Oaks Drive in Jackson, Mississippi. Literacy is knowledge and knowledge is power. Thank you for joining the Literacy Hour.
Good morning, Jackson, Mississippi, Laurel, Summerall, Hattiesburg. Good morning, Byram. Good morning, Richland. Good morning, Madison County. And again, good morning to all of our listeners right here in the great city of Jackson. Hinds County, we are thinking about you this morning. And well, everybody, it's Diabetes Awareness Month and it's Lung Cancer Awareness Month. For all of your tips and knowledge and information about these two conditions, you can visit our social media channels, Instagram, Facebook. We have been posting some very important bits of knowledge about these two conditions. You see, when we learn better, we tend to do better. And we want to be very well informed about diabetes and lung cancer. Listen, tobacco users over 50 breathe easier. You can get a life-saving CT scan because just like with other forms of cancer, including breast cancer, early detection saves lives and lung cancer as well. You can learn more by visiting msdh.ms.gov. That is our Mississippi State Department of Health's website. You know, I'm really high on that website. It's very user-friendly and it helps us to stay informed about the health status of our state, how we're doing. You go to that website, you're going to learn a lot. You're going to have access to some fact sheets about various conditions. You're going to learn about a lot of programs that the State Department of Health has that can benefit you and your families. And this morning, I just want to make sure that you know that lung cancer is the number one cancer killer in America. Number one. And testing can detect signs of lung cancer early and help protect the health of smokers or former smokers. So let's talk about these low-dose CT scans. Low dose simply means low-intensity radiation. Yeah, and that's how we perform CTs. You know, we got to use low radiation. Well, low-dose CT scans uses low-intensity radiation. And that radiation helps us to make detailed images, detailed pictures of your lungs. And if we can see the details of your lungs, then we can detect signs of lung cancer. Things that aren't supposed to be there. With these low-dose CT scans, we can see it. Early detection can find problems before you notice any cancer symptoms. You see, that tends to be what sends us to the doctor's office. Symptoms, feeling some type of way, not feeling our normal selves. But that's why screenings are so important, because screenings help us to detect problems before we notice any symptoms. When you can treat cancer earlier, treatment can be more successful. Don't you have somebody you want to be around here for? So if you're a smoker or a former smoker, I'm encouraging you this morning to access the Mississippi State Departments of Health program where you can get lung cancer screening with a low-dose CT scan. Who should be screened again now? If you have a history of heavy smoking, maybe you stopped, but you had a history of heavy smoking, you're eligible for the low-dose CT scan. Annual screening is recommended if you're 50 to 80 years old and you currently smoke. Or maybe you quit within the last 15 years. You're still eligible to get a low-dose CT scan. And you smoked an average of 2 packs a day for 10 years. The average number of packs smoked per day multiplied by the number of years you smoked is at least 20. And let me say that again. That's what we call a 2 pack a day for 10 years. We call that a 20 pack per day because you have an average of 2 packs of cigarettes that you smoke each for 10 years. Then the average number of packs smoked per day, we multiply that by the number of years you smoked, and now you got this 20 pack year history. You're at increased risk for developing lung cancer. So where can you access these low-dose CT scans? The facilities are available nationwide as well as in Mississippi. And again, on that website that I love, msdh.ms.gov, you can access it on your phones. You have access to internet bouncing off of these satellites. You have access to a computer or a laptop. If you don't, you can certainly visit Test Taking Solution. We're right there on 2104 Thousand Oaks Drive. You can use our computers. Come in and learn more about these conditions. Learn more about how to take care of yourself. Numero uno, number one, because you can't take care of anyone else unless you're taking care of yourself. We're talking about lung cancer if you're just tuning in. It is Lung Cancer Awareness Month. It's also Diabetes Awareness Month, and we're going to be raising some noise about them both. We're going to be talking about it and educating ourselves about what's the latest and the greatest in terms of treatment, in terms of screenings. And so I want you to be informed this morning. Early detection saves lives. Early detection can find problems before you start noticing cancer symptoms. Most insurance pays for the recommended lung cancer screening test. And you know, it's that time of year called Open Enrollment where you get to make sure that your insurance covers what you needed to cover. You get a chance to review what you have. This is the moment. Do it. Look at your insurance policies. Make sure that you are covered the way you know you need to be covered. What's good for the goose is not always good for the gander. What's good for your mama may not be good for you. What's good for your brother you got to make sure that you're covered, that you have access to the type of preventive tests and screenings that you need. Look at the insurance and see whether or not they provide those free of charge. That's important. They're supposed to. Preventive measures. Prevention is key. So you can find screening. If you're thinking about getting screened, talk to your doctor. Have a relationship with a primary care physician. Mid-level providers like nurse practitioners and physician assistants, you can have a relationship with them. They will help guide you in the right direction. If lung cancer screening is right for you, your doctor can refer you to a high-quality screening facility. And again, we have those facilities right here in Mississippi. You don't even have to guess on it. msdh.ms.gov has done all the heavy lifting for you. Go over there to the website, and I guarantee you're going to see a banner about lung cancer because, hey, we're raising awareness this month. And whoever is running that show over there, I don't know, but I'm just telling you they're doing a great job by keeping us informed. So the banner, click on that banner and find out as much information as you want to about where to get a low dose CT scan. And listen, it's nobody's business but yours. Okay. And that's why in medicine, in healthcare, your provider is supposed to practice high confidentiality, extreme confidentiality, keeping your information, patient health information, keeping your business safe and confidential. So go get checked out. Even if you have quit smoking, you can still develop lung cancer. Low dose CT scans can help detect lung cancer, whether you're a current or a former smoker. I want to make sure you understand that. All smoking raises your cancer risk. All smoking. Cigarette smoking, of course, is number one risk for lung cancer, but other tobacco products can do it too. So if you're a smoker of cigars or pipes, you also have an increased risk for developing lung cancer. And this cancer is near and dear to my heart because it's what took my grandfather out of here. Perhaps the closest person to me in my life. My best friend, my everything. My protector, my confidant, my hero. Lung cancer took him out of here. He was a veteran. So yesterday I thought about him so much and talked to one of my best friends about my granddaddy, B.F. Liddell, Benjamin Franklin Liddell. We were so very, very, very close, loved him so much. And lung cancer took him out of here. He smoked. And I was a little girl just watching him pull on that cigarette, puffing. And I just never really understood. Had I understood way back then all of what my medical training, my family medicine residency training have taught me today, had I known all of that back then, I probably would have pulled that cigarette out of his hand and say, no, stop, Granddaddy, stop it. I want you to be around here a lot longer. He increased his risk. And if you're smoking this morning, you are at increased risk for lung cancer. Take care of yourself. Go get checked, particularly if there's somebody you want to be around here for. You want to see your children graduate from school. You want to get to meet your grandchildren. You want to, yes, I understand. We can get killed some other kind of way. We can die other ways, Dr. Liddell. I understand that. Of course I do. But it's not a whole lot of things in our control. But the few things that are, we ought to take advantage of controlling them. And this is one of those things that we can go get checked out for. Of course, breast cancer is another. Cervical cancer is another. We have preventive measures that we can put in place. We have vaccinations. We have early detection tools. So the low dose CT scan, if I see you on the street now and I say, hey, you tell me all the time when y'all see me, Dr. Liddell, listen to the literacy hour. Keep the information coming. I'm definitely going to do that. I'm dedicated to doing that. But you be dedicated to learning then, okay? We're learning together. I'm making sure that the information that I share is accurate and up to date. And so it takes a fair amount of preparation, research to do that. And so I'll keep doing my part. You do your part. If I see you and you tell me you listen to the literacy hour, I'm going to ask you, how can we screen for lung cancer? And your answer should be with a low dose CT lung scan. A low dose CT. There's also free help in quitting smoking. If you have gotten to the point you're ready to quit, there's free personalized help with quitting. It's available, no charge, to Mississippians through the Tobacco Quit Line. That quit line is open 7 days a week. 1-800 quit now. Yeah, 1-800-QUIT-NOW. That means just look down on your phone, and the numbers on your telephone have alphabets underneath them. And so you would dial 1-800, and then for quit now, look for the Q on your phone, and you'll find that Q is underneath number 7, and the U in quit is underneath number 8, and so on and so forth. Quit now. 784-8669. A personalized quit plan from the quit line. Plus, feedback from a professional counselor will help you to meet your goal faster. Sometimes you just need another person to travel the journey with you. You know, it makes all the difference in the world when you got somebody right there with you, whom you know you can call in the middle of the night. You got one best friend. You're blessed. The quit line can become your best friend. They have counselors on standby to help you meet your goal faster. Visit the quit line to learn more about the services it can offer and to get started today. Quitting smoking has immediate benefits to your health, just like starting a walking program. Immediate benefits. It lowers your risk of heart disease, lowers your risk of cancer over time. So that's lung cancer screenings with low-dose CT scans. It's Diabetes Awareness Month as well, and I want us to be aware of some symptom of diabetes. Yes, it's Health Literacy Tuesday. Welcome to the Literacy Hour. Type 1 and type 2 are different types of diabetes. There's another type 2 called gestational diabetes, and someone that you know, or maybe you have been diagnosed at some point in your lives with type 1 diabetes or type 2 diabetes or gestational diabetes. Type 1 diabetes can develop in just a few weeks or months, and it can be pretty severe. Type 2 diabetes can take years to develop. And gestational diabetes doesn't usually have symptoms. Your doctor should test you for it between 24 and 28 weeks of pregnancy. As a family medicine resident, we had to deliver babies, and it was the joy of my life to help bring life into this world. That was perhaps my favorite part of family medicine was obstetrics and gynecology. I loved pediatrics as well. Just absolutely loved those aspects of family medicine. And gestational diabetes was not an uncommon diagnosis that I had to make. Gestational diabetes is when you acquire diabetes while you're pregnant. So what are some symptoms of diabetes? This is Diabetes Awareness Month. I want you to be aware, and I want to encourage you to see your doctor about getting your blood sugar tested. How high is your blood sugar? And you need to get it tested if you're urinating a lot. Peeing. Urinate equals pee. Urinate. So if you're urinating a lot, and particularly at night, that might be a sign that you have diabetes. If you're very thirsty, you just drank some water and you're still thirsty, that might be a sign that you have diabetes. If you're losing weight and you're not trying to lose weight, the pounds are just dropping off, you might have diabetes. If you're very hungry, you have blurry vision, numb or tingling hands and feet, feeling very tired. Now, I know these sound like some really non-specific type symptoms. Dr. Liddell, those can be symptoms of just about anything. You're right, which is why you need to get tested, because we want you to be sure of why you are experiencing urinating a lot often at night, being very thirsty, losing weight without trying, being very hungry, having blurry vision, having numb and tingling hands or feet, feeling very tired. Sometimes even your skin starts to become very dry. And sometimes you have a sore, and the sore heals slowly. I got a sore the other day. I thank God for Jackson Eye Associates. Man, they've been so good to our foundation. They donated some furniture, office furniture to us, and I couldn't round up anybody to get this furniture out of where it need to come from. People were working, and I respect that so much. So I rented a U-Haul, a 27-footer, y'all. I drove it. Yeah, it's a different experience. I got in that U-Haul, and boy, listen, ladies, you can do it too, right? So we have to do what we have to do sometimes. I rented that U-Haul and went on over, drove it from Highway 80 all the way over to Madison, and did a good job. I was so proud of myself, man. I tell you, I was just smiling. It really brought me joy to know that I could do this. And I got over there, and then I pulled that little, the little hutch thing. I pulled that out and got the dolly out. I loaded 25 chairs all by myself. 25. A great workout. Enjoyed it. 25 chairs. And then I drove back over, where they needed to go. Anyway, I got a little sore on my hand when we were letting up the storage room, because I did the very next day. My son Joshua, I thank God for him as well. He said, "Mom, we can just activate some of our church brothers." I thought, yeah, that would be a great idea. My goodness, that's wonderful. He facilitated from way from where he is. He called and set it all up, and man, in no time flat, my church brothers were there, young men, and so we were letting up the little storage door, and it came down just a little bit, not a big sore, just a little sore. But we're talking about diabetes, because sometimes you can get a sore and that sore can heal slowly. Well, I'm looking at my finger now. The sore is completely healed. It healed that night. I mean, it bled, and I had to, clean it and make sure, watching for signs of infection and things like that. But it healed the very next day. You want to know your body. Had that sore not healed, had that sore still been fresh right about now, I wouldn't be on the air with you. I would be in my doctor's office. I would be at Dr. Poe's office right now, because I'm going to take care of myself, and I want to encourage you to take care of you. I want to meet my grandchildren. I want to see my son get married. There's some things I want to be around here for. I want to watch the test-taking solution scholars become the leaders in our state of Mississippi that I know many of them are going to become. They are sharp. Boy, we got some of the sharpest young men and women being tutored, getting test prep services at Test Taking Solution. And I'm so very, very, very proud of them. I want to watch my staff, my team of experts go far in life. I got a lot of things I want to see come about. I want to watch our state boom even more. I think we're on the right trajectory. I've been watching it, and I'm telling you, I'm commending Governor Reeves. Yes, sir, because listen, our state, the businesses that are opening, the businesses that are being attracted to our state. We'll talk more about it during Financial Literacy Tuesday. We're going to talk about the money, the business development, the economic development in our state. Just tune back in on third Tuesdays. That's next Tuesday. And we're going to talk more about our economy and what's going on and what's available and jobs that may be available and grants that are available. Tune back in next Tuesday for financial literacy. We also going to review some financial literacy terms too now. The FDIC curriculum is strong. Federal Deposit Insurance Corporation. And we will be reviewing that. But that's next Tuesday. This Tuesday, we're focused on health. Just taking a break and learning a little bit about what? Lung cancer and diabetes. If you have a sore and that sore is healing slowly, I want you to go see somebody. Tell your employer that you got to get off work. You got to go see about yourself. And if your employer doesn't understand that, then I'm going to tell you this too. Look for you another employer. Employers got to begin to also understand that people are people and humans, and that there are certain needs that we have, and those needs must be met. And one of those needs is our healthcare needs. Another need is our mental health. And we talk about that on 4th Tuesdays, mental health and wellness. So join me back here then to learn about some resources that might benefit you and your family. But employers must understand that vacation leave means just that. I'm taking a vacation. It's my leave to take. Sick leave. It ain't none of your business where I'm going or why I got to go there. I'm taking the day that you gave me. So let me go. Employers, I'm talking to you. And I'm so glad I have the freedom to be able to do that now. I used to work for so many, and I've had some wonderful jobs over my lifetime. But I always felt like, and you probably feel this way too. There's some things at your job that need to be improved. And if you have the type of boss you can go to and talk to that person about your thoughts, then do it. Don't be afraid. There are some bosses, some employers who will listen, and they want you to have a great experience. But then there are others that don't care, just don't give a darn. You're going to put somebody in a room and expect somebody to work inside of a 4-walled room, no windows, for 8 hours a day. That is torture. I make sure all of my staff, every single one of my staff members, have a room with a window. And they can let the shade up or down as they see fit. Get some sunshine. They also are able to walk outside. Take your breaks as you see fit. Why? Because I have the kind of team, and you maybe have the kind of team that they're going to do the work. They're not lazy. They're experts in their own right. They're grown up. They're human, and we should respect them and treat them as such. I guess you can tell I love my staff. So if one of my staff members came to me and said, "Hey, Dr. Liddell, I hurt myself yesterday. I have this sore and I'm concerned about it. I need to go get it checked." I'm going to say, "Bye. I'll see you when I see you. Go." Because I'm also the type of employer, the type of boss who can do your job. And I also am the type of boss or employer who always cross trains. Somebody else can do your job. So go. You're in trouble when you have a business and everything hinges on you. You're in trouble when you have a business and everything hinges on one person in your business. Something is wrong. You gotta get out of that particular position. But help your staff to take care of themselves. Provide them the resources and the outlets as best as you can, and allow them to do that. And above all else, take care of yourself. So anyway, back to the story about how I moved these 25 chairs, and then the next day I got access to my church brothers. So very thankful for Brother Todd, Brother Ishmael, Brother T. Mac, and again, Joshua. Just so grateful for these young men who helped me to move some desks and chairs and cabinets and bookshelves over to our new Test Taking Solution Foundation Harvey site. And we're trying to get that site open on May Street. It's going to be a blessing to the community. It was just wonderful. And during the day, as we were moving things, the alarm went off on one of the young men's telephones. And I felt terrible. I said, "Oh, wow, I've had them here for maybe an hour and a half at this point. And that's too long. I got to hurry up and let them go." That's what I was thinking when that alarm went off. And let me tell you something. Boy, City Church doesn't stop. If you're looking for a church home, I want you. I'm begging you. I double dog dare you to visit City Church of Jackson. City Church of Jackson, where Pastor Luke Epperson is the senior pastor. And it's a church that has a group of people from all different backgrounds, all walks of life. And my son and I have been members of City Church before he was born. So that's a long time. And we've watched City Church grow, and it isn't stopping for anybody. City Church of Jackson, and I just thank God for it. My brothers were there when Joshua called them to help me. They were there, and when this alarm went off, I felt terrible that maybe I had held them too long, and so I immediately began to say, "If you have somewhere to go," but before I could say it, before I could even put the words together, one of the brothers turned to me and said, "It's time for us to pray." That just like that, and went right into prayer. Father God, thank you that we're able to be here today. Thank you that we have health and strength. Thank you that we are alive and well, that we're able to fellowship during this moving. Thank you, God. This young brother prayed, you all, and the others stopped, and we all stopped, and we all prayed, and it was the most beautiful thing I had seen in a long time. Here it is. I'm thinking the alarm was going off because the young man had somewhere to get to, and it was going off because he had set an alarm to pray. These are children that I've watched grow up from being little bitty kids. I remember when they were in the little kid classroom, and now they're grown men. And I enjoyed working with them on Saturday. So shout out to City Church for the continued work that you're doing with developing people and disciples. And shout out to all of the churches today, church leaders who are pouring into your young men and young women. Y'all, we can become a better informed, more empowered community if we focus on the right things. Anyway, I thank God that this sore has healed. It has healed completely, a little scab and everything. If you have a sore that heals slowly, get checked for diabetes. If you have more infections than usual, get checked for diabetes. I want you to get tested. Testing is simple, and the results are usually available pretty quickly. Your provider, whether it's a physician or whomever, is going to ask you, have you been eating, before they test, because we need to know if you just had a Snicker bar. We need to know if you just ate something, because it's going to affect what that sugar level will be. You'll need a blood sugar test to find out if you have what's called pre-diabetes or diabetes. All right? Let's talk about type 1 for just a moment. People who have type 1 diabetes, they may have some nausea, some vomiting, some stomach pains. And type 1 can be diagnosed at any age, but yes, we do tend to see it in the pediatric population. But that's not entirely true anymore. We see type 2 diabetes developing now more in children and teens than ever before. Why? Because of obesity. That's why. Increased fat tissue. That's why. And diabetes can have some terrible complications, you all. So you know, if you have a child or a teenager who is overweight, help that child, help that teenager to eat healthier, to be more physically active. Do your part as an adult to help that child not develop diabetes. Type 1 diabetes. It means that your pancreas doesn't make insulin or makes very little insulin. That's just it. That's type 1. You got some insulin and it's not working. Well, it's very, very, very little insulin. Or you don't make it at all. So if you don't make it, we got to give it to you. So people with type 1 diabetes need to take insulin every day in order to live. Because when you eat something, your blood sugar is going to go up. We need a hormone that can help get rid of that blood sugar. We need insulin. And God is so perfect. He created the pancreas inside of our bodies, and the pancreas job, one of them, is to release insulin. Currently, type 1 diabetes cannot be prevented, but it can be treated effectively. Without insulin, the blood sugar can't get into the cells and it builds up in the bloodstream. High blood sugar then is damaging to your body. It's going to cause all kinds of symptoms and complications. So a long time ago now, we used to call type 1 diabetes insulin dependent diabetes. Same thing, insulin dependent, because it depends on you having insulin. Or we used to call it juvenile diabetes. Same thing, juvenile diabetes, insulin dependent diabetes, type 1 diabetes. Listen, I was working with a group of college students the other day. We were reviewing organic chemistry. 2 or 3 of them had failed the organic chemistry test, and they contacted Test Taking Solution to assist them with their studies. And we had a great time talking about SN1, SN2 reactions, activation energies, etc. So much organic chemistry. I started them from the bare backbone minimum so that they could have a firm foundation. But when I got done, they were laughing and they want to put me to work at their school. And I'm telling them no. But they mastered that topic of organic chemistry. And I was so very proud of them. One called me and told me that the test they had the next day, they blew it out of the water. And I'm so very, very proud, because that's what knowledge does. It empowers you. And so I want you to know that type 1 means you don't have any insulin, or you have very little insulin, and we got to give you some more. So it's insulin dependent diabetes. It's juvenile diabetes. I told them, as like I was when we were doing the organic chemistry, I said, chemistry and science in general, there is a language and there are synonyms. There are words that we use to mean the same thing, and it can confuse you sometimes. Don't get confused. Keep it straight. And the same it is with this diabetes. Keep it straight. Type 1, no insulin or very little insulin. It's called also insulin dependent. Juvenile diabetes. It's less common than type 2. About 5 to 10% of people with diabetes have type 1. So you see, 5 to 10%. Okay. The other 90 to 95%, the overwhelming majority of people with diabetes have type 2. Type 2 diabetes. So since the overwhelming majority of people have type 2, we're going to talk about that as well. But with type 1, there's usually a family history. Somebody, a parent, brother, sister has type 1 diabetes. We don't know what really causes it, but we think some type of autoimmune reaction. The body attacks itself by mistake. We don't know. It attacks itself and it destroys cells in the pancreas that makes insulin. And those cells are called beta cells. Don't worry about all that today. Just know that your pancreas is a workhorse. It's a machine. And you want to keep your pancreas healthy. You want to keep your whole body healthy. So type 1. The body is acting against itself. We don't know why. Those cells in the pancreas called beta cells are destroyed, so they can't make insulin. Some people have certain genes. Those are traits that are passed on from parent to child, and it increases their chance of developing type 1 diabetes. However, many of them won't go on to have type 1 diabetes, even if they have the genes. There's some sort of trigger in the environment. You see, researchers, they go to work every day to study these type conditions. That's why funding to do biomedical research is so important. It helps us to better understand these conditions. So they have determined that there is sometimes a trigger in the environment, such as a virus, that may play a part in developing type 1 diabetes. Diet and lifestyle habits, they don't seem to cause type 1 diabetes, but they cause type 2. You see, there's a difference, and that's why we call them differently. Type 1 diabetes, type 2 diabetes. We're talking about type 1. And I'll be remiss if I don't mention type 2. So let's talk about type 2. Type 2 diabetes, I told you, it takes several years to develop. Some people don't notice any symptoms at all. Type 2 diabetes usually starts when you're an adult, but again, we're seeing it more in children and teenagers now. Symptoms can be hard to spot. That's why it's important to know your risk factors as well. Diabetes risk factors. You may have a family history of diabetes that runs in your families. Pre-diabetes and type 2 diabetes share almost all of the same risk factors. You're overweight, obesity. If you don't get that weight off of you, I'm telling you right now, you can potentially be diagnosed with diabetes in the future. We got to become more physically active. Another risk factor, you're age 45 or older. You're at higher risk for getting diabetes than somebody who's younger. If you have a parent or a sibling with type 2 diabetes, if you're physically active less than 3 times a week, you're at risk. If you have non-alcoholic fatty liver disease, you are at risk of developing type 2 diabetes. If you've ever been diagnosed with gestational diabetes, again, that's diabetes during pregnancy. Or if you've given a birth to a baby that's over 9 pounds, then you're at risk for developing diabetes. And certainly, if you're African American, Hispanic, or Latino, American Indian, Alaska Native, some Pacific Islander people, some Asian Americans, we're all at higher risk. So it's important to know your risk factors. Why? Because if I know my risk factors, now I can work on reducing my risk. Some risk factors like age and family history, you can't do anything about those risk factors. They're there. But there are some risk factors that you can reduce so that you don't develop prediabetes, type 2 diabetes, gestational diabetes. Behavior changes, increase physical activity, get up from behind that desk. In this day and time, a lot of people have desk jobs, typing on the computer all day. Listen, you got to set your alarm, like the brothers who helped me to move, and they set the alarm so that they would be reminded to pray. Set your alarm so it will remind you to get up out of that seat and walk down the hall. Do something. Get up. Jog in place. Do something. Eat a healthy diet. Lose weight if you're overweight or obese. Small gradual changes can make a very big difference. You don't have to do anything real drastic, just small changes. They're the type of changes that you tend to keep up with anyway. You know, if you just make small gradual changes over time. So that's type 1, type 2 diabetes. We've talked about lung cancer, and I've told you that diabetes has certain risk. And one of those risks is diabetic ketoacidosis, DKA. You may have seen the article. It was published by Mississippi Today. Gwen Dilworth, she wrote an article called "Man with No Criminal Charges Died from a Complication of Diabetes in Alcorn County Jail." The gentleman's name was James Tash. He had no criminal charges pending against him when he died in jail from a complication of diabetes. He was 48 years old. You see, don't forget, risk factor is if you're 45 or older. He was 48 years old and had been jailed waiting on mental health treatment during Mississippi's involuntary commitment process. And when he was found unresponsive in his cell in Corinth, on January 17th, he had been detained for 12 days. No criminal history. The man just needed help, but he had diabetes. His death was caused by diabetic ketoacidosis, DKA. It's a condition that develops when the person's body doesn't have enough insulin for blood sugar to provide energy to the cells. And that's what the state medical examiner's autopsy report said. So this gentleman, rest in peace, was diabetic. And so they're investigating or they have investigated. They're looking at that, and I don't know what the outcome of all that was. I brought it up simply to share with you how dangerous, how life-threatening DKA can be. So you don't want to have undiagnosed diabetes and you're walking around here and next thing you know, you have developed DKA, you've gone into a full-blown attack, and next thing you know, you're dead. Go get checked. The next time you're at your doctor's office, you say, have you checked my sugar? Check my sugar for me. And like I told you now, you tell your doctor whether you're fasting, meaning you haven't eaten anything before you get your blood drawn, or your fingers stuck. Okay. You make sure they know. Or if you have eaten something, you tell them, I just ate such and such. Diabetic ketoacidosis. We don't have time to get all into the medicine behind that, but I just want my listening audience to be aware of DKA and how it is real. So take care of yourselves. And I know it's easier said than done. Dr. Liddell, you talking about go to the doctor. Some of us don't have health insurance. Well, that's also what I want to talk about today. And it's a big topic in our state anyway. I think Hobnob 24, we don't get into all the political stuff. I could care less about all of that. What I care about, though, is that there are discussions about Medicaid expansion, tax cuts, etc. And so some people just hold on. The working poor, I believe, is going to see a brighter day. The expansion of Medicaid coverage to cover the working poor is something that I'm understanding our legislative leaders are having conversations about. So that's one form of health insurance. It's Medicaid. Medicaid expansion has been the discussion for quite some time in our state. I want you to be aware that the marketplace on healthcare.gov. Go to healthcare.gov. It runs from November 1st to January 15th. Open enrollment. You can enroll in a health insurance plan. And some people got great plans and they're paying $10 or less based on your income status, on your situation. You can get insured. CMS encourages, and CMS, we've talked about it here many times, Centers for Medicare and Medicaid Services. That's a federal agency. They're encouraging all consumers to select a plan by December 15th so their coverage starts on January 1st. Consumers who select a plan between December 16th and the end of open enrollment on January 15th can have coverage that starts February 1st, 2025. More consumers than ever before are able to save on coverage through the marketplace. In fact, 4 out of 5 consumers who enrolled through healthcare.gov can find a plan for $10 or less per month with certain credit benefits and financial help. Yeah. For assistance with the application process, consumers can contact healthcare.gov. They have a call center with assistance available 24/7 in 200 different languages. 1-800-318-2596. Consumers can also find a local assister, which Test Taking Solution Foundation is a certified designated organization. We have certified application counselors on staff who can also assist you with the marketplace. Yeah, certified. You can contact an agent or broker as well, insurance agent, insurance broker. You can go to healthcare.gov and select find local help and get help that way too. But get some insurance so that you can go to the doctor's office, take care of yourself. And man, some of those plans offer vision, dental, plus health. and some offer one or the other. So you go out there and you see what's best for you. Members of my team and I will be at Grocery Depot this upcoming Friday. We're going to be there from 11 a.m. until 2 p.m. in the food court. Yep, right over at Grocery Depot. We have lots of information and resources to share with you. And if you haven't already, I want you to download that Grocery Depot app and start saving whenever you're in the store. I'm certainly going to do some shopping while I'm over there. I enjoy Grocery Depot. So we'll be there on Friday just for a few hours to help you with whatever you might need. We got some resources for you. We'll help you with the marketplace if that's what you want. Members of my team and I will also be helping you with the 502 Direct Home Loan Program, certified by the United States Department of Agriculture. Again, we're enhancing literacy. We're mitigating health disparities. And how do you do that? By addressing social determinants of health. And that's what we're doing at Test Taking Solution Foundation. I'm so thrilled and so proud. We had board members, Dr. Robin Harvey. She's been moving stuff. Yes, sir. I mean, we're not too educated and too this and that to clean toilets and to do what we have to do to move desks, to move chairs. She's been moving. Brother Dean Johnson, another board member. Thank God for him. Thank God for all of our board members. They have been working hard. I think Brother Dean probably did about 4 or 5 trips with his trailer filled with furniture. We're trying to get the Harvey site open for you. That's right. And so we'll be putting some calls out later on for the community to come and help us with various aspects of that. Just stay tuned. Anyway, we're committed to helping you get signed up for insurance coverage. Our foundation helps people enroll in health coverage through the federally facilitated marketplace on healthcare.gov. We focus on education, outreach, and enrollment efforts to underserved and diverse communities. So I want you to come out now. You can come out this upcoming Friday, 11 a.m. to 2 p.m. We'll be at Grocery Depot, or you can hit up the community health fair that's going to be held this Saturday, November 16th from 10 to 2 at the Peggy Calhoun Community Center over at 4243 Willowwood Boulevard in Jackson. Yes, it's being hosted by the Association of South Jackson Neighborhoods. Boy, Mr. Ward, they don't stop. They're presenting their annual community health fair. Test Taking Solutions is going to be there. I would love to meet you. Come stop by our table. But again, we're going to be at Grocery Depot this upcoming Friday from 11 to 2. It's health literacy here on the Literacy Hour. And, being literate is so important. We want to have an ability to find information. That's good. But you also want the ability to understand that information. That's even better. And the best of all is being able to use the information and services to inform your health-related decisions. So that's why we focus on the social drivers of health. Research suggests that up to 80 to 90% of our health status is determined by social determinants of health. Not the pill we got to take, not going back and forth to the doctor's office, but whether or not we're going to be healthy, 80 to 90% of the time is dependent on our social determinants of health. And what are social determinants of health? We've talked about it here many times, and we'll continue to talk about it. It's low education level. That puts you at risk for having poor health outcomes. Racial segregation, that puts you at increased risk of doing poorly. Low social support. You got to have some social support. Got to be connected to something. Listen, I told you about City Church, and you may have your own church. There are some great other churches in the city as well. You might have other organizations. I'm a Zeta, and so you might have Greek organizations, but you need social supports. Poverty, lack of health insurance. These are social determinants of health. And maybe you got health insurance, but it's no good. It's inadequate. It's not covering everything that you need it to cover. Check out your health insurance, you all. Make sure that it's covering what you need it to cover. And if it doesn't, get rid of it. This is the time to change. It's called Open Enrollment. Okay. The Mississippi State Department of Health Maternal and Child Health Programs want to hear from you as well. The Mississippi State Department of Health creates a new plan every 5 years to improve health outcomes of families, women, infants, children, and adolescents around our state. They depend on families, youth, communities, healthcare professionals, and other stakeholders to share ideas and needs. And so they've been having some listening sessions and hosting focus groups across the state. On yesterday, it was a focus group in Greenville at Greenville Higher Education Center. And also at the same time, they held one at Homewood Suites by the Hilton, Jackson Fundren Medical District here in Jackson. And today they're going to be having a focus group down in Gulfport, Mississippi at the and we got a call, it looks like. And so good morning, caller. You're on the air. Thanks for listening to the Literacy Hour. What's your question or comment?
Hey, how you doing?
I'm doing well, ma'am.
I want you to educate me, Dr. Liddell. I got two facilities I went to, and I had health insurance. I got everything that I needed. One of the facilities is suing me. I'm getting $200 taken out of my check twice a month. I'm not understanding it. And I had health insurance. I had got everything that I needed.
Okay, so let me make sure I understand what you're saying. You're saying that, and someone said, okay, I'm getting some notes where people say they've tried to call in. For those of you who have just sent me some notes saying you tried to call in, maybe you're calling the wrong number. The call-in number is not you, ma'am. You hold tight. I'm giving the call-in number to some other people. 601-714-8378. That's the call-in number. Sure, we're heard on 3 radio stations, and maybe you called the station. Don't call the station. Call 601-714-8378. We're very grateful for WMPR 90.1 FM. We love WFQY 99.1 FM, and we absolutely love WGDQ 93.1 FM. We have a caller on the air. This caller is sharing with us right now that she had health insurance. And I want to make sure I'm understanding what you're saying, ma'am. You say you had health insurance, you went to get seen about to take care of yourself, and then you skip part of the story because now you're telling me that they're taking $200 out of your check. Tell me what happened. You went to go see somebody, a health provider. You had insurance. Did your insurance cover what you went there to get seen about?
It's supposed to, but it didn't, because it did. They wouldn't be charging me. They wouldn't be garnishing my check.
All right. So see, stop right there. You have just highlighted why it is so important for people to check in during open enrollment right now. It is so important for people to check in during open enrollment to make sure they have the insurance coverage that they need. You said, yeah, it was supposed to. You see, it sounds like whatever you went to see the doctor about, your health insurance didn't cover it. So guess who you need to be on the line with and who you need to be talking to and giving a fit? The insurance company.
Okay.
You need to call your insurance company and talk with someone there to say, I went to see the doctor, and on my policy, you were supposed to cover such and such, but you didn't cover it. And so now I need you to help me with this situation. So, ma'am, again, thank you for calling in. Thank you. And I want you to have a great rest of your day, okay? I got some other callers. Oh, you are so welcome. I got some other callers. Let me see who this is. Caller, you're on the air. What's your question or comment?
Okay, I'm a person. I have Medicaid, but let me turn my radio down. I have Medicaid, and can I qualify for that type of insurance because I need dentures in my mouth, and Medicaid don't cover the dentures.
Yes,
So,
ma'am.
I can't afford the insurance, our other insurance. I'm trying to see what can I do to get extra dental to help me cover, or where can I go? Is it somebody who would help me get the dentures?
Oh, ma'am, I love you. I'm so glad you want to take care of yourself.
Ma'am, I love you. I'm
That's
so glad you
that is first and foremost. Because here's the deal, and you just hold tight. You've asked your question, and now I'm going to answer your question. You said, I have Medicaid and I want some dental coverage. I want some dentures. I need some dentures, and they won't cover it. Well, again, we're talking open enrollment. It's open enrollment time. It's time for us to get the health coverage that we need. And that includes vision, that includes dental. And I want you to do this right here for me, ma'am. I want you to call Mississippi Division of Medicaid. Their job is to provide access to quality health coverage for vulnerable Mississippians like you. Get on your line, 601-359-6050. They're open right now. It's 8 o'clock. They're open. You burn that phone up. You tell them that you want this particular coverage, and they will help you. That's their job. They go to work every day to help vulnerable individuals to get covered. So I'm glad you called. Yes, the marketplace is available. I told you what to do with that. Healthcare.gov. You can go out there. There are some supplemental. Okay, you got Medicaid. You can have additional insurances. You can have more than one insurance, you all. Yes, you can. So what I'm saying is, if they turn you around, I want you to go to healthcare.gov and check out those as well. But I believe you're going to find the help you need with the Mississippi Division of Medicaid. That's why they're there, ma'am. Thank you for calling in. Caller, you're on the air. And my time, listen, let's take a station break. And then, caller, I'll get you on the other side. Let's take a station break. All right, and we are back. And again, now your radio station might be going out, but listen, this YouTube channel is still going. You can go to our website, ttsfoundation.org, and click on the Literacy Hour tab and scroll down until you see something about the Literacy Hour YouTube channel. Click on that and you can hear the rest of the show. All right. So we're not going to stop. We're going to keep going because you guys have good questions. Caller, you're on the air. What is your question or comment?
Good morning, Dr. Liddell.
Good morning. Oh, man, this sounds like Mr. Bird.
Yes, ma'am. I just want to remind your listening audience, we having a free health clinic this weekend from 10 o'clock at the Page Calhoun Community Center, the Willowwood Community Center, this weekend from 10 o'clock to 2 o'clock. It's absolutely free. So that way they can come out and hear in person all those individuals that's going to be there to make them whole again.
Oh, I love it. And listen, we talked about it early on in the show. I shared with the listening audience that members of my team and I are going to be at Grocery Depot on Friday from 11 a.m. until 2 p.m. in the food court, sharing some vital information, helping folks get connected with health insurance, etc., because we are a certified designated organization by the Centers for Medicare and Medicaid Services. I also shared with them that we're going to be at the community health fair that your Association of South Jackson Neighborhoods is sponsoring. What a wonderful way to give back to this community. Mr. Bird, is there anything else that you want to share with the listening audience while you're on this morning? Because in my experience, man, you have so much wisdom. You just a philosopher. And I love to just sit and listen to you talk. So is there anything that you want to share with our listening audience? Not about the health fair, man. Tell me something else. Anything you say. Again, sir, I just tended to enjoy hearing you speak. So now speak to the listening audience, sir.
It's the same here. My thing is, I tell people each and every day we are servants. If we are allowed to open our eyes in the morning time, coming from the states of dream and rest, that means that we have to get up and get to work. And one thing you have to always keep in mind, that tomorrow is a promise. So we have to take time to value the time today. And healthcare, physical care, financial care, all those factors make us who we are and make us happy. If the scripture says you're going to be heaven on earth, that means that we got to take care of this body of ours, which is the temple, the first temple. So to all the listening audience, make sure you take care of yourself. Make sure you take care of yourself physically, spiritually, and in all aspects of life. And one thing we try to do is, I always tell people, work together. In other words, meet me in the middle. Then we'll work out everything else once we get together. Again, I'm inviting all the listening audience to come out to the Peggy Calhoun Community Center. Let's just fellowship, if nothing else, and get healthy.
Wow. And for those of you who don't know, the Peggy Calhoun Community Center is located at 4243 Willowwood Boulevard here in Jackson, Mississippi, 39212. I thank you so much, Mr. Bird, for calling in, sir. And you know you have a standing invitation to be a guest on the Literacy Hour anytime you want. I want you to have a great rest of your day, sir.
You too, ma'am. And thank you for all you do. And to listen on this, trust me, Dr. Liddell is phenomenal. I don't know what other words come up with.
Wow.
If it's out there, she's going to be on it and make sure that our listening audience and the communities are benefiting from it.
Well, I'm going to do my best to keep doing so, sir. Thank you so much. Have a great rest of your day, Mr. Bird. Listen, you all, we are 6 minutes on the other side of the hour. And listen, I don't want Mr. Jones. Oh, boy, that's probably my producer now. He's about to, well, y'all listen. Let's just hold tight and see what he's going to say. Mr. Jones, you're on the air, sir, and I'm sorry. We hear you.
I call in this morning to apologize to you and every other Black woman on behalf of Black men.
Wow.
Hello?
I hear you loudly and clearly, sir.
All right. When you told the story about how you had to physically move furniture.
Yes, sir.
Go get a U-Haul.
Yes, sir, I did.
Do manual labor.
I did it.
And the word, I know, but listen, this is what I'm saying. I'm calling in this morning. Now, see, other men may not be ashamed. It may not bother other Black men.
My Lord.
I don't know if we can call ourselves men. All right. When we allow our Black women, and you said that you injured your hand.
I did.
In the process of doing that.
I did.
In 2024, this is where we are in the African American community. When we allow our Black women to do what you all have to do in order to try to move our community forward.
Wow.
Now,
I really appreciate
it. Say this morning. And let me say this. I'm out now trying to do some things. All right? But we should be ashamed of ourselves when a woman cannot pick up the phone call and get manual labor done in the African American community. It says a whole lot about where we are. Thank you so much and have a good day.
My Lord. Thank you so much, Mr. Jones. Listen, see, I thought our producer was about to call and tell me, Dr. Liddell, listen, we got to go. And I know we have to go, you all. And I told you now, the radio stations, you can shut it down. But YouTube channel, we're going to keep it going just a few minutes. I got another caller. Caller, you're on the air. Caller, you're on the air. What's your question or comment?
Oh, Dr. Liddell.
Yes, we hear you.
Good morning. How are you?
I'm doing well, sir. Thank you for calling into the Literacy Hour.
Good. I was calling about trying to make an appointment to come in and see you, but since I'm on here, I'd just like to thank you for your work and everything that you're doing in the community as far as the health stuff going.
Wow.
And I think it's very informative, so I just like to keep up the good work.
Thank you for that.
I was calling in to schedule an appointment for something else with you.
Oh, I love that. Well, listen, we open at 9:00. So if you call back at 9, I'm sure my staff will be happy to get you in and get you taken care of. They might be able to handle it, but whatever it is, we're going to get it taken care of. Thank you for listening to the Literacy Hour, sir, and you enjoy the rest of your day.
Yes, ma'am. You take care. Thank you.
Okay. Boy, we got, I tell you, just some amazing people in the community. And what Mr. Jones said is near and dear to my heart. It does touch me. But, you know, in all fairness, I didn't bother anybody. Now, there were, you know, some men passing by as I loaded these chairs and stuff, and they didn't offer. But that's okay. Again, my church brothers, I really appreciate them, man. They came. Now I paid them. I'm always paying people to do stuff. I do the best I can to maintain and to keep our foundation going along with our board members. But if somebody asked me, Dr. Liddell, come help me move this chair, or Kentrell, can you pick this up, or do this over here? If I have the time, I'm coming and I'm going to do it. And I don't want you to pay me a dime. I don't want a dime. Okay? Because listen, guys, at some point, and I know how tough it is on everybody. That's why I don't mind paying folks for help, because see, everybody ain't in the same situation. And so you got to take care of folks who take care of you. But it just hurts my heart when I see all of this funding, all this money, and we can't access much of it to do the things that we need to do, no matter how hard we try, how great your credit score, how great your financial situation, etc. But that's another topic for another day. We've been here and we've done what we need to do this morning here on the Literacy Hour. Remember now, the information shared during the Literacy Hour, either by the host or guest, is for educational purposes. It doesn't constitute medical, legal, financial, or tax advice. For specific advice that's applicable to your situation, I want you to contact a licensed certified professional, preferably one with whom you have a relationship. And remember, relationships matter. Relationships matter. So join me back here next Tuesday, if the good Lord allows all of us to live and see it, where we'll be discussing financial literacy. And you don't want to miss it, because I'm going to give you an update about the PACT Act and tell you what's going on with Camp Lejeune. Veterans, I love you. I have veterans in my family, and I'm going to tell you all kinds of things, what's going on, and make sure that you stay up with what's going on. We got a new administration federally getting ready to come in here, so we have to stay informed. In the meantime, nutritious eating, physical activity, social activities. Yeah, I want you to get socially connected. You ain't got to show up at everything. I'm one. I don't show up at everything, but there are some social events that are empowering, and that where you can connect with some good people. Come on out to the Association of South Jackson Neighborhoods Community Health Fair this upcoming Saturday. I'm going to be there. Mr. Ward's going to be there. And you just heard from Mr. Johnny Bird. He's going to be there. Some good, positive people. And you'll have other vendors there who will be providing you with some information that you can use to help you and your family be even more empowered. Listen, I love you guys. Thank you so much for listening to the Literacy Hour. And if you ever find in your heart to help underwrite the show, please give the radio stations a call. And if it's $1, we'll take it to help keep us on the air. Thank you guys so much. God bless you, and have a great rest of your day. No matter what, I want you to keep going.
For the past 1 hour, you have been listening to the Literacy Hour with Test Taking Solution and your host, Dr. Kentrell Liddell, MD, M.B.A. We are located at 2104 Thousand Oaks Drive in Jackson, Mississippi. Visit us on the web at www.testtakingsolution.com. Join us each Tuesday from 7 to 8 a.m. for another life-changing conversation here on our podcast live stream at affiliate stations.
Good morning. It's Dr.